Welcome back, ladies and gentlemen, brothers and sisters, and friends, to the Everyday Life channel, a place where we share knowledge about health, medicine, and scientific lifestyles in a way that is approachable, easy to understand, yet accurate, so that everyone can proactively protect themselves and their families from the health risks that exist around us. In recent days, the Nipah virus, a name not unfamiliar to the medical community, has once again appeared in international news following the detection of a new outbreak in India, although no cases have been recorded in Vietnam. Due to its dangerous transmission characteristics and extremely high mortality rate, the Nipah virus has been classified by the World Health Organization (WHO) as one of the viruses with the potential to cause a future pandemic if not strictly controlled. So how does the Nipah virus enter the human body? Why is it considered one of the most dangerous viruses ever discovered? And what are the early warning signs that everyone needs to pay close attention to? 1. Origin and transmission routes of the Nipah virus. The Nipah virus is a zoonotic virus, originating from animals, with fruit bats identified as its primary natural reservoir. The virus is present in bat saliva, urine, and feces, and can be transmitted to humans through several routes, according to the WHO. The Nipah virus does not spread long distances through the air like COVID-19, but it is highly transmissible through close contact, especially via direct contact with secretions from bats, birds, or intermediate animals, such as pigs, eating fruit bitten by bats, or consuming raw date palm sap or fresh coconut sap that has not been processed. Close contact with infected individuals, especially when providing care without protective measures, exposure to respiratory secretions, saliva, or cerebrospinal fluid of infected patients. These characteristics make Nipah virus particularly prone to spreading within families, hospitals, and small communities if people are careless or lack proper preventive knowledge. 2. After entering the body. How does Nipah virus attack? After entering the body through the mouth, nose, or open skin wounds, the Nipah virus rapidly replicates in the bloodstream and spreads to vital organs, especially the brain and lungs. 2.1. The brain, the most dangerous target, according to the WHO. Acute encephalitis is the most characteristic and dangerous manifestation of Nipah virus infection in the brain. The virus causes inflammation of small blood vessels, brain swelling, cerebral edema, direct damage to nerve cells. As a result, patients may rapidly develop severe symptoms, including sudden high fever, intense, persistent headaches, dizziness and abnormal drowsiness, confusion and altered consciousness, seizures, progression to coma within 24 to 48 hours. What is particularly concerning is that many cases initially present with flu-like symptoms, leading patients to delay seeking medical care. By the time they are diagnosed, severe brain damage may have already occurred. Statistics show that Nipah-related encephalitis is the main cause of death or long-term neurological complications such as memory impairment, movement disorders, epilepsy, behavioral and personality changes. 2.2. The lungs, a dangerous parallel complication, beyond the brain. The Nipah virus can also spread to the respiratory system, causing severe lung damage. When the virus attacks the lungs, it leads to inflammation of lung tissue, damage to pulmonary blood vessels, impaired oxygen exchange. Patients may experience cough and rapidly worsening shortness of breath, rapid, shallow breathing, severe oxygen deficiency, rapidly progressive respiratory failure. In severe cases, Nipah-related pneumonia progresses extremely quickly and can become life-threatening in a short time, especially when it occurs simultaneously with encephalitis, compared to seasonal influenza or common respiratory viruses. Lung damage caused by Nipah is far more severe and difficult to control, making treatment highly complex and increasing the risk of multi-organ failure. 3. High mortality rate. Why Nipah is classified as extremely dangerous, according to the WHO. The fatality rate of Nipah virus infection ranges from 40% to 75%, depending on the outbreak and access to medical care. Even more alarming, there is no vaccine currently available. There is no specific antiviral treatment, Treatment is mainly supportive care and intensive life support. This means that early detection and prevention remain the most critical weapons in protecting the community. 4. Global situation and regional risk. The Nipah virus was first identified in 1999 in Malaysia and Singapore, causing more than 100 deaths and leading to the culling of approximately 1 million pigs to control the outbreak. Since then, Nipah has remained a recurring public health threat in South Asia, particularly in Bangladesh and India. Recently, a new outbreak in West Bengal, India, recorded 2 confirmed cases, 3 suspected cases, more than 100 people placed under quarantine. Although India's Ministry of Health announced that the outbreak has been controlled, many countries have tightened airport health screenings, reflecting the high level of global vigilance toward this virus. In Vietnam, although no cases have been reported, the Ministry of Health has instructed enhanced monitoring at border checkpoints, close surveillance within communities, public communication to raise awareness about disease prevention. 5. Preventive recommendations. What everyone should remember, according to recommendations from the WHO and the Ministry of Health, people should avoid eating fruit that is being bitten by bats or birds, avoid consuming unprocessed date palm sap or fresh coconut sap, limit close contact with individuals showing suspicious symptoms, wash hands frequently and properly, protect the respiratory tract when caring for sick individuals, use appropriate personal protective equipment in high-risk environments. Just one careless action can open the door for a dangerous virus to enter. While proper preventive awareness can protect not only yourself but also the entire community, the Nipah virus is not a distant threat. It exists in nature, silent, hard to detect, and can emerge at any time if we lower our guard. Correct understanding, early prevention, and timely action are the best ways to protect ourselves and our loved ones. Thank you for watching the Everyday Life channel. Don't forget to follow the channel to continue receiving practical, easy to apply knowledge on health, medicine, and scientific lifestyles, helping each day become more proactive, more secure, and healthier. See you in our upcoming content.